Thrombosis is the formation of blood clots inside blood vessels, which can lead to serious complications, including heart attack, stroke, and other cardiovascular diseases. However, the disease develops gradually, and therefore, it can be prevented. To do this, one needs to understand the causes of thrombus formation and the foods that contribute to it. What are thrombi? Blood is a kind of fuel for our body, supplying oxygen and nutrients to every cell. However, the flow rate of blood can vary significantly among individuals, depending on its viscosity. With high blood clotting ability and, consequently, slow blood flow, platelets accumulate along the vessel walls. By sticking together, they can transform into thrombi, gradually increasing in size. What is the purpose of thrombi? Their task is to stop bleeding in case of cuts and other injuries. Without the formation of thrombi in such situations, we would die from the slightest damage to blood vessels and capillaries. However, the drawback of this wise defense mechanism is that thrombi can form inside undamaged vessels. If this process is not stopped, a thrombus can block blood flow in the vessel, leading to tissue necrosis, ischemic heart disease, and, in the worst case, heart attack and stroke. If blood flow is blocked in an artery, the person will die instantly. Fortunately, such consequences do not occur very often. According to international statistics, out of 100,000 deaths annually, 1,500 are due to thrombosis. Overall, various manifestations of thrombosis occur in about 70% of the world's population during their lifetime. Why do thrombi occur? What contributes to increased blood viscosity and, consequently, thrombus formation? First and foremost, it is dehydration of the body. Inadequate water intake, especially in hot weather or during intense physical exertion, can lead to negative consequences for the circulatory and cardiovascular systems. Secondly, toxic poisoning of the body. Vascular walls and blood composition suffer during infectious diseases and various poisonings, including alcohol-related ones. Elevated levels of cholesterol, calcium, or glucose in the blood also have a negative impact. Sometimes, it occurs due to diseases related to disrupted metabolism and the absorption of fats and carbohydrates. Finally, diseases of key internal organs, namely the heart, lungs, liver, kidneys, and intestines, also lead to blood thickening and the formation of thrombi. A history of stroke and chronic heart failure are risk factors for thrombus formation. The list of risk factors is quite extensive, including anything that somehow reduces a person's mobility or disrupts normal blood flow in their body. This includes excess weight, a sedentary lifestyle, bed rest for more than 3 days, varicose veins, oncological diseases, limb injuries, and even prolonged air travel. How does food harm? As for food products, their role in thrombus formation cannot be underestimated. It is particularly important to be cautious about consuming products that slow down metabolism or other biochemical reactions in the human body. In general, products dangerous in thrombosis can be divided into 5 groups. First group. This group includes smoked products, meat, and animal byproducts, as well as any animal fats. All of them contribute to an increase in cholesterol levels in the blood. Processed meats, including smoked products and semi-finished products, also contain a high amount of salt and sugar, which negatively affects the condition of blood vessels. Among animal byproducts, it is worth noting the liver, kidneys, and heart. They promote hemoglobin production and increase iron reserves in the body. But this is beneficial only for people with low levels of these elements. For those with a tendency to blood clotting, consuming such food is harmful. It's important to understand that all the listed products are difficult to digest and put a significant load on the liver. The liver plays a key role in both the formation and dissolution of clots. Therefore, reducing the burden on this organ helps stop clot growth and, combined with proper treatment, achieves their dissolution. Second group. The second group includes coffee, chocolate, and various extracts with tonic effects. The reason for their prohibition in thrombosis is the same, a burden on the liver. In addition, their tonic effect is associated with stimulating the sympathetic adrenal system of the human body, leading to increased blood clotting. Third group. The third group consists of any products that contribute to the formation of gas in the intestines, such as black bread, cabbage, and apples. Despite seeming unrelated to clots, abdominal bloating leads to impaired blood flow in the vessels of the lower extremities, thus promoting the progression of thrombosis in this part of the circulatory system. Fourth group. The fourth group includes products rich in vitamin K. Although this vitamin is essential for humans, it increases blood clotting. Doctors even treat thrombosis with vitamin K antagonist drugs. Therefore, those at risk should exclude spinach, lettuce, and beef liver from their diet. While this is not an exhaustive list of vitamin K-rich foods, these products contain it in significant quantities. Fifth group. The fifth group essentially consists of one product, but it is presented in stores in a variety of forms. Any alcoholic beverages, regardless of their strength and preparation method, negatively affect all stages of clot formation. This influence begins with the disruption of protein synthesis in the liver and continues with dehydration of the entire body, leading to blood thickening and creating an optimal environment for clot formation. In addition to the listed groups of products, it's worth mentioning some that are not completely contraindicated but require moderation and caution. These include buckwheat, beans, and walnuts. While these are very healthy products, they contain substances that increase blood clotting. Therefore, they should not be the basis of the daily diet for those at risk of thrombosis. Attention! Sugar, salt, and trans fats. Let's talk separately about salt and sugar. Salty food disrupts the body's water-salt balance and leads to subsequent dehydration. As mentioned earlier, these are favorable conditions for the formation of blood clots. Various pickles and preserves are particularly dangerous due to their high salt content. Sugar increases blood glucose levels, thickens the blood, and disrupts the metabolism of fats and carbohydrates in the body. All of this reduces the intensity of blood flow and creates favorable conditions for platelets to stick together and form clots. Industrial confectionery products, in particular, contain a significant amount of sugar. Therefore, sweet lovers should be cautious. However, even amid the diversity of the mentioned products, there is one that stands out. Trans fats. They are not a standalone product, but a component of many foods. Trans fats are especially abundant in baked goods, various cheese products made from vegetable milk and oil substitutes, as well as margarines. Consuming trans fats leads to a sharp increase in blood cholesterol, the formation of plaques on blood vessel walls, and a decrease in their elasticity. As a result, platelets settle on the plaques and clots begin to form. In some countries, product packaging includes separate information on trans fats in addition to the overall content of fats, proteins, and carbohydrates. Trans fats can be identified in a product's composition by the presence of the text. Contains hydrogenated vegetable oils. In conclusion, it is worth noting that the risk of thrombosis has significantly increased in the last 2 years due to the coronavirus pandemic. People recovering from this ailment often complain about vascular problems and blood clotting issues. Among the mandatory therapy after recovering from the disease, doctors prescribe blood-thinning tablets. Like any medication, they have numerous side effects. Therefore, it is essential to take care of your health in advance by maintaining a diet that supports the circulatory system in a stable condition. Thank you for watching until the end. Don't forget to like if you enjoyed it. See you in the next video.